Hi everyone, Dr. Cary Yurkiw. Thanks for joining me today for this webinar called Financial Strategies for Health Professionals. We're going to talk about how to take control of your finances, practical strategies to build wealth, and secure your future as a health professional. So what you're going to learn today is profit boosting pricing models, cost cutting without compromise, rock solid cash flow management, tech and tools for return on investment, debt and saving strategies. So we're going to talk about all those things today, which can really make a big impact on your bottom line. So are you tired of seeing revenue slip through hidden costs? You want clear, actionable templates, no jargon, no fluff. You just want suggestions and clarity as far as what to do. I know I've been there myself in the past, so I know what it's like to not know what to do or what you're doing wrong. It's helpful when you have a coach or a consultant that can guide you through the steps. You need strategies you can apply immediately in your practice. You want to see results like tomorrow or today, and you're ready to build a stronger, more profitable and resilient business. So that's what we're going to talk about today. I'm a health professional. I've been practicing for over 30 years. For most of that time, 25 years, I've owned my own practice, and I've been a leader in helping other healthcare practitioners to grow their practices. So I blend hands-on experience with a think big, act smart mindset. I've authored books, led workshops, and helped practices from solo operators to multi-location clinics unlock new levels of financial clarity and confidence. So for profit boosting models, how can you generate more revenue, how to decrease your expenses, and how can you manage your money better? So we're going to talk about that today. So how can you generate more revenue? Well, you can look at your price you charge per service. So every year at the end of the year, actually before the end of the year, I talk to my staff about ways that we can improve our pricing model for the following year. I tend to look at inflation rates. If they're around 3 or 4%, we want to raise our rates 3 or 4%. We also want to look at other ways, maybe some discounts we've been giving or some ways we've lost some revenue. We want to brush up on that. And that could be done at any time, but one of the best times to do that is at the end of the year, because people are expecting raises to the rates for the following year. You also want to look at revenue streams. Are there other revenue streams that you can add to your practice? So maybe you're providing a certain type of service, but there are some complementary services to that. You want to take a look at that and add those services in if possible. And products sold. Are there any complementary products to the services you're providing? And can you get those products into the clinic and then help your revenue streams so that that average price per visit goes up? Some other things that you can look at is decreasing expenses, in particular variable costs. So those are costs that can go up and down, costs that can be negotiated. It's hard to change fixed expenses like rent, but when your lease is coming due, that's a good time to negotiate that. But variable costs could be things like wages, how you're using your staff for help, the supplies you order, some of the subscriptions you have in the clinic. You might want to take a look at those and just see if you're using the subscriptions. Are you scheduling your staff properly? And are there any other variable costs that you could trim? And I like to look at the income statement. I like to have an income statement done at the end of the month promptly, so by the 1st or 2nd of the following month. And then I can review the previous month's income statement and then make some good decisions going forward. For cost cutting, renegotiate supplier costs. So you want to sit down with your suppliers and see if you can get a better rate or get a competitive supplier to give you a better rate for those products. Automations are good ways, like reminders for no-shows, so it cuts down on lost income. Your software often can provide reminders, just a phone call from the staff to say, just confirming you'll be in tomorrow. Depending on your service again, if you have to block off an hour or hours for your service, that's really important. If you have multiple services happening at the same time in the clinic, not as important, but still an area where there could be some lost wages and lost income. You just don't want to miss out on that. And a simple phone call, reminder text, and email can be very helpful. And for wages, you want to train your staff, put some money into training, some time and effort into making the training better so that it's more efficient for your staff and your practice. And then you want to schedule accordingly based on the employee's strengths. So some employees might be better at certain tasks than others. You want to delegate those tasks and play to their strengths, whereas the other employees might be better at other things. So it's important to use your resources wisely. So now I'm going to talk about cash flow. What can you do to improve your cash flow? So how can you generate positive cash flow in your practice? Well, one is more revenue. We've talked a lot about that. We just talked about less expenses, but you can also have less debt. So you can refinance your debt, get a lower interest rate, which brings your interest costs down. You can start to pay down your debt and be debt-free, which can really improve your cash flow as well. And then you can invest in your future. So take that money and invest in things like equipment, property, your own practice, even personal real estate or investments can really help you long term. So you can generate more positive cash flow by increasing your revenue, reducing your expense, having less debt or refinancing, consolidating debts, starting to repay, have a strategy for that, and then investing in your future, owning your own practice, owning your own building, owning your own equipment, and then putting money into your home or investments, especially ones that are tax-free, like your principal residence, especially ones that produce more income for you, maybe a revenue stream. So they're very good ways to build up your net worth and your equity in the future. Now for tech and tools, how can you use tech and different tools to help your practice? So automation is trendy and it's important, especially using AI to automate. So things like answering the phone or phone calls, especially after hours phone calls, can be very handy. Sending out appointment reminders, which we just talked about. And then some assistance, like maybe some marketing programs in your clinic. You might want to outsource those. We've been doing really well with our Google Ads in the past few months, and it's producing a lot of new clients for our practice. So just getting some help from someone on how to do better with Google Ads, how to do better with Facebook ads, and how to use software. Software that can speed up the efficiency in your practice, maybe transcription software or note-taking software, or software for billing. These types of automations can give you a lot of assistance in the practice. And then streamline those procedures, primarily for time management. So your time is valuable. You want to use your time efficiently in the clinic. Time management, very important. And then your expectations, meeting and exceeding the patient's expectation first, so that you get more referrals in the practice, you get better ratings in the practice, your Google ratings. We're at 99 5-star reviews, so we're just one away here, and that'll put us in the as one of the best clinics in our city. And we've only been on our own here in this location for 2+ years. So I'm very excited about that. If I could carry my Google ratings from the previous clinic I was at, the group practice, I would be one of the top ones. But I think getting your ratings up whether it's Google, RateMDs, or other platforms, you definitely want to meet and exceed patients' expectations so you get a really good reputation. So what did we learn today? Well, we touched on profit boosting models. We touched on cost cutting without compromise. We talked about rock solid cash flow management. And then we talked about smart tech and tool investments for your future. Now, how can you put these into practice in your clinic? Now, I can remember going to webinars or seminars and then thinking, okay, that sounds really good, but then how do I do that in my practice? Like, what exactly do I do to get started? And that was a little bit confusing for me. So I found the coaching sessions that consultants provided to be very helpful, the one-on-one coaching in particular. Now, you can join us for a 4-week practice finance mastermind. That'll be coming up the next 4 weeks after this webinar. And that'll be a group session. It's $297 US. And at those sessions, you can participate, ask questions. We can go over specific examples of practices that need help. And I'll give you some one-on-one coaching on these topics that we discussed today. You could schedule a one-on-one strategy session just for your practice with me. That's a 60-minute session for $199 US. There's a limited amount of spots for that. So I would definitely go ahead and schedule that immediately. And then there's the one-on-one coaching package for 13 weeks. That's 13 sessions at a time that's convenient for you. And we go over your particular situation and how our coaching can help you. So there's 3 ways that you can benefit from our service beyond this webinar, but in relation to the information we provided today. So just to summarize, to take the next steps with me, you could do a weekly group sessions where there's peer learning and accountability. Templates will be included in these sessions to help you. You could do the one-on-one initial session, which is a custom financial game plan for you, personalized solutions, and you can walk away with some action steps. And third, you can get some ongoing practice, private coaching, weekly accountability and support, and transform your practice's finances so that in 13 weeks, you'll be in a lot better shape than you are today. To get these services, you just have to scan these QR codes. Just take out your phone and with your camera, scan these QR codes. Depending on which one you're interested in, it'll take you to our checkout page. You can go ahead and buy that package or that session, and then we'll schedule that at a time that's convenient for you if it's a coaching session. For the mastermind group, we're going to let you know when that is. Most likely it'll be on a Saturday morning early, or one day on the during the weekday in the evening. Depends on the group, who signed up, and just getting a good time for everyone to meet on a weekly basis for 4 weeks. So I want to thank you for joining me for this webinar today. I hope you learned something about practice finances. And if you have any questions, you can type them in the chat here on YouTube. You can also email me, or we'll talk at the one-on-one coaching session or the mastermind classes coming up in the next few weeks.